Your CNOS Health Watch on Siouxland News.
If you have a cold or the flu, you depend on your immune system to fight it off so you can get better. But what happens when your immune system turns on you?
Our very own Katie Link caught up with an MS specialist to learn more about the disease.
Normally our immune system helps us to fight off colds or infections. And in the case of MS, there's a mixed signal that occurs. And so the immune system actually begins to attack part of our own body.
Specifically, the brain and spinal cord. Dr. Elizabeth Hartman is CNOS's first multiple sclerosis specialist. She says that the onset of MS is actually fairly young.
In general, MS affects people between the ages of 20 to 30. However, it can affect children in rare cases. And as well, there's been patients who've been diagnosed in their 40s and 50s, not uncommonly, rarely 60 and beyond.
MS is a progressive disease, meaning it tends to advance as the patient ages. Although no single cause has been determined, extensive research has found that there is a trend of who is affected.
We have learned that there are certain things that make people more likely to develop MS. We know that women are much more commonly affected than men by about a 3-to-1 ratio.
You also have a higher risk if you are related to someone who has MS. Each patient, however, may have slightly different symptoms.
We develop trouble with vision, for example, vision becoming very dark or very blurred in one eye, often with pain with eye movements, and that's what we call optic neuritis, or inflammation of the optic nerve. And that's a common presenting symptom of MS. It can occur in about a third of patients who develop MS.
With the brain and spinal cord under attack, movement can also be an issue.
Other common symptoms can be problems with sensation, such as numbness or tingling. Other ones can develop including trouble with walking, and this may be because both legs are weak or because just one leg is weak. It can also affect coordination and balance.
With advancing treatment options, the outlook for patients has greatly improved. For Siouxland News, I'm Katie Link.
Now next week we'll look into new treatment options and how they're improving the lives of MS patients.